So I wanted to welcome everybody to the Soffer Longevity Podcast. What we're trying to do here is really show everybody the evidence-based information that sort of is swirling around the internet but needs to be understood by experts and experienced clinicians and allows everybody to feel good about the newest longevity trends and science and information that then can help us to all live longer, live healthier, enjoy a longer health span. It's not just about a lifespan anymore, it's a health span. So we're going to have guests. We're going to go over data. We're going to make sure that there's a library of information that will be available for everybody to use an evidence-based approach. We call it the Soffer scoring system that's going to rank everything A through F, A being lots of double-blinded type trials, F being may not want to touch it. And through that, everyone can learn about the longevity practices, treatments, diagnostics that will help us to really enjoy this next era of medicine where it's not all just about the reactive stuff that we've had to do, stopping heart attacks, finding cancers, but we'll actually get to the root cause of everything and maybe prevent them from ever happening, enhancing our health span. So sit back, enjoy our guests, enjoy the information we're presenting, and don't forget to subscribe below and tell your friends about it so we can enjoy this community of information together. Thanks so much. So, Dr. McLeod, I wanted to both congratulate as well as welcome you to the Soffer Longevity Podcast. You're not only the first guest, but you and I are going to be doing kind of a lot of co-anchoring through the days here as we build the library of our evidence-based perspective of traditional medicine and longevity medicine, of which I know you have such a deep both passion and background for. So maybe you can give me a little bit of background or more for the audience per se, what they may want to know about you as it is towards your training in medicine and then longevity.
Okay. Well, thank you very much for the invitation. This is great. My background is in family medicine. I started out as a faculty member, so did full spectrum family medicine from hospital to outpatient. We did surgeries. I did obstetrics. So yeah, everything. Absolutely everything.
What a great background.
Yes. And then I kind of fell into wound care. There was an open position, and the chief of surgery at the hospital, he's like, I think you would fit into this role well. So I only started with 1 day a week, and then we went from there, and I absolutely fell in love with wound care. So then I ended up being the medical director and worked there full time until I came down here to Florida and then started into the functional medicine side, because then we're not limited by what the hospital would let us do.
So tell me, now that you got all this great background, so great sort of family practice, a well-rounded medical training, then you got the surgical training, which included wound care, so really understanding sort of what happens when people either didn't take care of themselves properly or found themselves in traumatic situations. Now comes functional medicine. First of all, give me that definition of what is functional medicine, and also how did that trajectory build your experiences?
So functional medicine, the way that I think about it is like traditional medicine usually gives you the what. So what disease you have. Functional medicine kind of answers the why. So why did you get to this point? So that is really the way that I think about functional medicine. When I started here in Florida, because I was able to do hyperbaric medicine kind of outside of traditional hyperbaric, so we were able to treat people that were not that fall into that insurance category.
Right, in the Northeast, including Yale and
we were only allowed to treat unless it's one of those FDA approved indications. But down here, we were allowed to treat outside of that. So then I was able to figure out, okay, well, I can do this. There's other testing that insurance doesn't cover. We can start doing this testing, and that's how I got into the functional medicine part.
What is your exact definition of functional medicine?
It is trying to get to the root cause of
Root
the
cause
disease.
medicine. So you'd spent a lot of time with, the ill effects of disease, and now you're like, okay, let's get to the root cause. So you became very interested, and you took courses
and just
certifications and that sort of thing. And maybe one of the few people that has this much experience in what is a lot of people called medicine 3.0. So this sort of new era of medicine where the root causes are what people are really interested in.
Yes.
The nice thing about my trajectory has been a bit different. So I was in the heyday of cardiology, training out at Cedars-Sinai after finishing University of Miami, and saw the first balloons and the first stents, and was really at that point where traditional medicine was so cool, because that was, the treatment for a heart attack before my training, right before, like months before practically my training, was 2 weeks of bed rest. I get a heart attack, put them in an ICU, and a couple of weeks of bed rest. As I continued my internship, residency, fellowship, et cetera, it began, okay, let's consider a balloon, and then a stent, and then even special types of bypasses and things like that. So the bottom line is that we were treating the disease to save lives. So what I call is cardiologists are kind of the OG, the old school longevity doctors. We try to make people live longer, but we sort of jumped into the play, if you will, or the movie. We jumped in at the point usually of a heart attack. That's when they were calling us.
Yes.
So all the while we're like, well, we don't want to have this. How do we stop that? So a lot of us got very interested in prevention. Initially it was kind of cholesterol prevention and lipids and things like that. Now it's a whole host of what they call immunologic treatments or inflammaging and all these words that are much more than just cholesterol. We don't just treat a cholesterol. We look at calcium scores. We look at, VO2 testing. We look at so many other things that.
And now you have the Clearly, which kind of gives you a whole other
plaques
perspective.
Before they have a problem. So the bottom line is the crux of this podcast is the intersection between both of our perspectives, both substantial. I'm much grayer than you, so I have a little more experience. But my experience has been mostly on, okay, now you got it, what do you do with it? Or do you have it or do you don't? Don't you have it? Not necessarily how do we incorporate some of the newest things, because they've only been around a couple of years. In fact, some of them aren't even here yet, whether we call them peptides or stem cells, things that are on the cutting edge but maybe not ready for prime time yet, but they're going to come through functional medicine.
Yes.
Right?
Definitely. That's
So you had what I found really interesting with your perspective was this, wound care led you to hyperbaric oxygen treatment, which is, really cool. So like pretend that you're on a dive, and those of us that have dove in the past, you go underneath, you can actually feel the pressure, but it means everything's kind of, pressurized. You may get oxygen to places you normally wouldn't have gotten it. So you were doing that for wound care, so you got experience there, but then now there's so much evidence showing that it can help with things like, cognition or anti-Alzheimer's, as some people might want to call it, or
long COVID. Has been a big one that's been emerging because of they found that it's helping them recover.
Even things as extreme as an anti-aging, because I understand the telomeres. Tell me a little bit about that, the telomere.
So telomeres are the little caps on the end of the chromosomes, and as you age, those telomeres get shorter and shorter and shorter, to the point that, if at the very end, they're not working very well, and then the chromosomes can kind of unwind. So you want your telomeres kind of longer to protect your chromosomes. So there has been an Israeli study that with hyperbaric oxygen, they did 60 treatments, and they would test their telomere length after 30 treatments and then test it again after 60 treatments, and it actually elongated their telomeres.
So I've heard the telomeres interestingly called the kind of the ticking of our aging.
Yes.
And that, as they unravel, because they're kind of like the caps at the end of a
Shoelace.
right? And as that unravels, you're closer to the end of your journey than the beginning, right? So enhancing your telomere situation is seemingly enhancing maybe how long you get to live, at least at the genetic components of it. It doesn't, you're not going to walk in front of a bus.
Exactly. Yes. It won't help you with that.
But outside of that, it could help in terms of all the anti-cancer things we have going on, the immunologic things, the atherosclerosis, the buildup of heart disease things that we have going on. So
Because
things
it's
like
protecting those chromosomes.
and hyperbaric oxygen therapy has been pretty clearly, from what I've seen in the evidence, pretty clearly tied to, at the very least, that as a surrogate marker for aging.
Yes, totally agree. Yes.
So yeah, it's so fascinating to me. It's not necessarily proven as a surrogate, as a non-surrogate marker, meaning we don't really know yet if someone does, say, 60 dives, I think they're called, that they are going to live longer, because that takes a long time to figure out, right? Because you have to let the person live longer, so they have to wait 20, 30 years for that study. But it does tell you that their telomere lengths pretty clearly are better, right?
Yes, because it's measured. They measure them, at day 0, then day 30, then day 60.
And I don't want to get too off on a tangent, because the idea of this first inaugural podcast is to introduce you to the audience, as well as to introduce the Soffer Longevity Podcast as really a library for folks to be able to sort of have different information pieces on things like telomeres. We'll do a whole segment on telomeres.
Yes.
We'll do a whole segment on hyperbaric oxygen. We'll do a whole segment on, ApoB or peptides or what have you. So I don't want to get too into one thing, but this is a fascinating one. And I heard just this morning, because I really spent a lot of time finding out what even social media is saying to basically be ready for when my patients ask me. But this famous guy, Brian Johnson, he's some sort of billionaire that has decided that he never wants to die.
Yes.
I think it's called Don't Die,
Don't Die
is his book or his perspective. And he's coming at it, I think, from at least to some degree, intellectual and philanthropic perspective, like why must we die? Maybe that's a whole different podcast. But without the sociologic and socioeconomic issues in and around that, one of the things he was saying this morning with the podcast I heard was that because he has been so deep into his anti-aging regimen, his telomere lengths are that of a 10-year-old.
Yes.
Now, he did hyperbaric oxygen, and he was able to show it went from, and I'm paraphrasing, I think the nomenclature used was like kbs. So it went from like 10 kbs to, just, what is it, a 10.2 or something like that. So, or is it the other way around?
It's getting longer.
Getting longer. So 10 to 10.2. So I said it correctly. So it got longer with, I think he did 30 days of hyperbaric oxygen. And he said, well, that was just a modest improvement, but it was only modest because he was already doing anti-aging. Now, someone like myself, who I just turned 60, I would see a much more dramatic improvement in my telomere length, which, as a surrogate marker, would suggest that I could be able to live a whole bunch longer, as long as that holds that length for an extended period of time. So do you see this for extended periods of time? How long do these changes last, let's say, for instance, in the telomeres?
Well, that's the problem, is that we don't know, because we haven't checked them in 20 years to know, if...
But you have great experience. You're one of maybe the most experienced people on the planet when it comes to hyperbaric oxygen. You really are, not just because you've been around it a bunch, because you came at it with such a wonderful background. So would you say anecdotally, which we'll a lot of times do this, we're going to have different types of evidence. We're going to have the best evidence, which is going to be multiple randomized trials, and then we're going to have anecdotal evidence, meaning a bunch of smart docs are saying, hey, I'm seeing something.
Yes.
So go ahead. What do you think? What's your gut?
Well, I think with that Israeli study, because they did so many people, that the the telomere lengths were increased, and they were fine. Like they tested them later. I think they tested them again at 5 years, and they still
had that.
Yeah,
and that's been your experience so far. You haven't seen like this. I feel great, and now it deteriorated. I got to go back into the chamber.
Well, they actually say that it is good to kind of just do like a couple of sessions or something every year, just to kind of help maintain.
Isn't that interesting?
Yeah.
So I'll tell you another personal experience of mine that's not too dissimilar, had to do with the GLP-1 experience. So I wrote you probably know, I wrote a book called Prescription Strength, an Amazon bestseller for a day. It really wasn't. But I wrote it a few years ago when I had sort of chronicling my own both experience and the research I had done when it just came out, meaning in my case it was tirzepatide, Mounjaro, or Zepbound. So I had started with a very low dose, able to stay on the low dose. The 2.5 was considered the initiation dose. And I did it for like 4 months, and then I was off of it for the next 2 years, and I didn't gain any weight back. About at that 2-year mark, roughly, it started to come back a little bit. And I did another initiation dose of the 2.5 for 2 weeks. And whatever was going on stopped, and I didn't need it for another year.
Yeah.
So
it's the same idea. You just need like a little top off.
Top off. People call that, some people call it microdosing. I don't call it microdosing because microdosing suggests taking just a tiny bit, and the pharmacokinetics or the sorry about that. The pharmacokinetics that are involved here are very interesting, meaning they'll test the doses and how that works on individuals. So by the time you get a dose that's released to the market, they know that the lower dose usually doesn't work.
Yeah.
So I'm not a huge believer in microdosing, like going to a compound pharmacy and take a little bit that maybe you don't even get to feel. But I am a bigger dose of the intermittent use.
Yes, I agree. I definitely agree with intermittent. Yeah. Yes.
Intermittent use.
Yes.
And then we could start talking about intermittent fasting, which
Yes,
I also do,
yes.
which has also been shown for, well, tell me about what your thoughts are on intermittent fasting.
Well, I think it gives your body a chance to kind of recuperate itself, so it's not so busy digesting and working through all the things that the GI tract needs to do. They've noticed that it increases sirtuins, and there's other factors that go on when you intermittent fast.
Yeah, I personally do it. I did it. I started at the beginning. It's been an amazing thing. I don't go crazy. It's the 16-8. So,
Yes.
I stop eating at 8 p.m. I start eating again around noon. I eat whatever I want during that time frame within reason. I try and give myself about 3-4 hours before my last meal and sleep.
Bedtime, yes.
But I, just as you know, you're my functional medicine doctor now, and you know how well my glucose metabolism was. And I attribute it to that.
Yeah.
I really do attribute it to the intermittent fasting. I think if I had done it before my start intermittent fasting, I think it would have been much less steady.
Stable. Yeah. Because those numbers were amazing. Yeah.
Do you?
Yes, I do. Yes, I.
What are your hours?
I do try to stick to the 16-8. Sometimes my fasting would increase a little, it just depends on the day.
When's the last moment of the time that you eat? What time do you stop eating?
I do try to stick to that 3 hours before bed. So.
It's funny. I've been trying to do that, and that's the hardest thing.
It is.
I've been able to kind of mesmerize myself. Some might say hypnotize myself. Like I'll have this hot tea before I stop eating. And I've told myself, okay, kind of close my eyes. When you hit the hot tea, you're done. When you do that, you're good. Nothing more other than water.
Yes.
And that worked for me. It does work for me because I get, I'm in a household with, nighttime activities and people and so forth. And so, yes, you almost have to add that discipline. And what it does to me anyways, it does start a different type of metabolism in my body that I know goes through stages, but I do sleep better. I feel better during the day, and my my month-long glucose monitoring was thankfully terrific, where I don't think it would have been before everything. Yeah. But this is fun. So the idea with this podcast is really just to have two doctors from different perspectives. So more traditional, lots of experience in, middle of the night heart attacks for many years and the surgical things that needed to be done in and around that. And your deep-based family care, then functional medicine perspective that got trained at the highest levels. And we are able to have a conversation and integrate the two. So you have the proactive, the reactive medicine 1, 2, and 3.0 all together to hopefully engage people that are listening to best understand what we're hoping to do, which is to be a library of evidence-based perspectives, our experience, our anecdotes, going through the data, presenting it in a way that is enjoyable for people to listen to and build a library of this. So
it's going to be fun.
It's going to be fun. I thank you all for listening. We are going to be back every week giving you lots of information. So don't forget to subscribe. And with that, for Dr. Soffer, Dr. McLeod, and Soffer Longevity, thanks so much for listening.